Health Spotlight, presented by Community Health Network.
Let's welcome WISH TV medical expert, former U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, the big health story last couple of days. First Lady Jill Biden has tested positive for COVID. The White House says she is experiencing mild symptoms. The diagnosis, though, comes just a few days after her visit with high school students in Westfield. And I know you told us your first thought turned to how the White House discovered she had COVID.
Well, exactly. We know that many people out there don't have the ability to do surveillance testing, meaning just testing to know whether or not you have it if you don't have symptoms. So the question is, was she sick? Was she really sick? Is that what prompted in the test? Or was this just a routine test that the White House does when the First Lady travels? It matters in terms of the message it sends to the public about whether or not we should be testing. And it also matters in terms of how sick she actually is.
Well, let's talk about what this means for vaccines and boosters. I just saw a couple of minutes ago, I don't know if it's fair to say that you've sounded off on Twitter, but you are addressing this on X, I should say, about what this could tell the rest of us as we're trying to navigate this virus still.
Well, and that's really what I try to get at on Twitter. I'm trying to help people understand, what does this mean for how you navigate your life? And ultimately, what it means to us is we're in the midst of a COVID surge. Even the First Lady has recently come down with COVID, and she was just through Indianapolis, so there's a really good chance she got it while she was here in Indianapolis. It's circulating. And if you're high risk, you need to be aware. If you get symptoms, you need to seek out a test, because seeking out that test can allow you to get treatments such as Paxlovid. It also means that when that new booster is available, if you haven't been recently infected, then you need to make sure you talk to your doctor and get your questions answered and get that new booster if your doctor recommends it, because you don't want to be in a situation where you're one of the 15,000 people who last week ended up in the hospital because of COVID.
So let's take this out of the White House and talk about households in Indiana. There really is no way to regularly test for COVID if you have a family member in a high-risk group.
Well, and that's the problem, Drew. And that's why I pointed out that contrast between the way the White House seems to be treating this, even though recently the White House COVID czar said that most people could ignore COVID, and the way the general public is able to respond to it. I want everyone to have the tools to be able to protect themselves. And again, if you have symptoms, please seek out a test, because it can lead to treatment, which can keep you out of the hospital. That is the key here. And if you're able to, keep a couple of rapid tests around. I have a couple in my house just in case someone does get symptomatic. But many urgent care centers, you can go in and get a test if you're feeling sick. We don't want it to go downhill quickly.
Yeah, that's a good reminder as well. So one final question tonight. We appear to be in a surge right now. Should we expect numbers to keep growing, or can we say that we're at a peak for the summer?
Well, I thought you might ask me this question, Drew. So I went to the Indiana State Department of Health website a few minutes before I got online with you. And what's interesting is they haven't updated their numbers since August, almost 2 weeks ago. It's hard to tell where we are, but I can tell you based on the numbers that are on that website from 2 weeks ago, we were still experiencing exponential increases. And from what I'm seeing in the hospital and in the community, there's no reason to believe that we've hit our peak yet. I expect a few more weeks of a continued uptick in cases before we level off and then eventually start to come back down, which means if you haven't gotten it yet, you're still at risk. You still want to take sensible precautions, particularly if you're vulnerable or someone around you is vulnerable.
Helpful insight. He is Dr. Jerome Adams. Thank you, sir, as always, for your time.
Thank you. Take care and be safe.